And Maria, if you're looking to supplement that retirement fund, the Powerball jackpot today is at $930 million, roughly the amount it takes to make people notice that it's time to buy Powerball tickets.
Indeed.
Those are still just $2. Mega Millions is $5 now. They went to that model in the last year to hopefully jack up more of their prize pots to reasonable amounts of money. And they've had 2 people hit their jackpots in the last month.
Are you at the point where you're buying now? Is it the jackpot high enough for you to?
I ebb and flow with lottery tickets. Like I never buy like daily 3 or daily 4 because the reward isn't enough. You know, you win 500 to 1 or 5,000 to 1. Here, your $2 can turn into 900 million before taxes.
There was some talk that you could purchase your tickets from home via the computer.
You can.
Can you do that now?
Yeah. Yeah, you send in your money, and you can buy as many as you want for as long as you want, I guess. But I think it's capped on a year, I think.
I have a cousin who typically, she lives outside of Pittsburgh, and she typically gives for people's birthdays, special occasions. She'll buy lottery tickets for you. And for my birthday last year, I won $50.
Woohoo!
But yeah, you either send it in or you have to truck on up to right over the Pennsylvania border to
spend
get your
$60 in gasoline to get your
$60 in gas. No, I just sent it in.
Just remember, don't give those tickets to minors. That is illegal.
Yeah, there you go.
Our guest in this segment is from WVU Medicine and one of the sponsors of this segment, Jeannie Constable. Jeannie, good morning. Welcome. Thank you for being patient with us.
Good morning. Thank you. And those lottery tickets sound awesome. What a great gift.
Yes, $930 million for the Powerball. Mega Millions is at just $70 million. Who wants to win $70 million when you could win $930, Jeannie? And then you can make a big donation to the funds at WVU.
That's right. Just think of all the possibilities.
The foundation.
Or you can make a big donation to the funds of our choosing. Your and I, Maria's choosing.
The Stubblefield Endorsement Fund. Yeah. Jeannie, we had you on last week as we were talking with Pasha Majdi, who was telling us of his story and his fight with cancer and the new center in Jefferson County. For those who missed that interview, if you could recap what the construction expansion project is in Jefferson County and what specifically you'll be able to do in treating cancer patients now that you weren't able to do before this project got underway.
Sure. So at Jefferson Medical Center, we're expanding the campus at the existing hospital to kind of bring everything together in one convenient location so that it's accessible. If you need lab or imaging or your primary care physician suggests you see a specialist, it's all accessible and easy to get to. So it's a $60 million project. There's multiple phases of the project. So at the end of the project, we'll have a 3-story addition connected to the existing hospital. And in that addition, we'll have medical office space, imaging, lab, ancillary services. And we're also going to go ahead and shell some additional space for future growth of our community. But what's happening right now on the existing hospital's 3rd floor, we are already renovating to make way for an oncology and infusion center, which will be part of our WVU Cancer Institute. So this will be a 12-bed unit so that people who are struggling with cancer or have other conditions that need infusion therapy don't need to travel out of Jefferson County to receive that care. So as I mentioned, the construction has just started. We are hoping that by like the March time frame, the framing will be up enough that we could let people come up and take a peek inside the space. Right now, it'd be hard to visualize where everything's going to go. And the construction should be complete late summer, early fall. So I'm thinking September-ish. And at that time, we'll do a big splash to make sure everybody knows they can come receive care there if they need it.
That's great. Do you have any other construction updates for any of the other projects in the area for WVU Medical?
Oh, we sure do. We have a lot of projects going on. So as you all know, we have a major construction project at the Berkeley Medical Center campus. So the construction for the first phase, which was the parking lot, is underway. I don't know if you're ever driving around campus. We're doing a little bit of blasting to make way for that new parking lot right off of Tennessee Avenue. So that's in full effect. But there's also some other things going on the campus that people might not know about. So we are working on our LINAC vault. And that might be a term you're like, what is a LINAC vault? It stands for Linear Accelerator. And it's a piece of technology that supports radiation for cancer patients. And the way that this technology works is you need a really thick concrete barrier around the LINAC, right? So that it's safe for everybody else. So construction has started on that as well. That's happening at the Dorothea McCormick Center. So that one should be complete. We're hopeful around July. The tower, so this is the new patient expansion onto the existing Berkeley Medical Center. This winter, probably in the February timeframe, we're going to start the actual building build right on campus. So we're going to have some clear signage, and we're going to make sure that the community is very well aware. But we are going to have to redirect a little bit on campus while we're putting this big addition up. So that'll start in just a couple months. We also are moving our behavioral medicine, and we're making a really large expansion over on Viking Way in Martinsburg. That could be complete in March, and I don't need to not be committal with these timeframes. It's just in January and February, we get a lot of snow. And so sometimes some of these construction projects have some variables that could impact the dates.
Sure.
But that is the timeframe we're planning on. December 1st, we moved our Spring Mills urgent care right down the street. It's across from the Walmart. And so that's a beautiful new space. And our previous building, where on Campus Drive, where the urgent care was located, we still have that building. We still have services in that building. We're going to expand our orthopedics office on the first floor where the urgent care was. So that's what's happening in that building. And then, of course, just we're going to keep moving forward with some of the big milestones with both the Berkeley and the Jefferson expansion. So lots of things going on. And, you know, you might say, like, well, what's with all the construction? And really, our goal is access. And access can break down in a lot of ways. So we want to make sure that we have space with our projected population growth and our changing population demographics, and making sure that we're taking care of our neighbors. And sometimes that means you need more services. Sometimes that means you need more beds in your hospital. And a lot of times that means you need more providers and physicians to deliver the care. So something else I want to share is the high volume of new physicians, nurse practitioners, physicians assistants that have started. So I'm looking at this list of folks who've joined our organization since October 1st through December 22nd. There are 40 physicians and advanced practice providers on this list. And we have anesthesiologists, emergency room physicians, ear, nose, and throat, orthopedics, family medicine, neurosurgery, nurse midwife, obstetricians, pediatricians, behavioral health experts. So a lot of different specialists coming to our Eastern Panhandle community to make sure that people in our community don't need to travel outside of our community for all the different types of care they need, and making sure that we have enough physicians so that we are keeping up with the demand for services. So lots going on.
Jeannie, does that mean you have 40 additional employees, or did some or most of those replace others who left?
Most of these are additional. We've created about 130 new jobs this year because of the growth. So we have had a few retirements, but the bulk of this list, I'd say over 90% of it, is new added physicians.
Maria.
So, Jeannie, talk a little bit about, so people are always concerned with parking, and I think I've said before that in the mornings I take a really early exercise class and notice the buses down at Bethel Assembly of God picking up folks who go in very early, but by the end of the day, that parking lot is filled with employees. Your additional parking across Tennessee Avenue is primarily to accommodate patients' families and those who are using the services, correct?
Yeah, we are going to be adding additional parking over on that side, and we will have the shuttle. So if folks need help getting all the way back up to the door, they'll have it. Eventually, there'll be a pedestrian bridge across Tennessee Avenue, so it's a little safer for folks to navigate up to where the hospital is located. The goal is that the parking spaces immediately next to the hospital are for patients, visitors, and a few on-call physicians who need real quick access to the building. Staff are going to be encouraged to park either at the Bethel lot or at some other staff. We use like yellow lines instead of the white lines to indicate we're staff, so it's a little further away so that we give the close parking to those who need it the most. So we are constantly looking at these numbers and mapping out during the different phases of construction. It's kind of like a puzzle. Like, where are we going to put parking if we need construction equipment on this side? And what are we going to add here? So we have it mapped out so that at all times there's enough parking. I know parking really comes up a lot. I've observed just in the time that I've been with the organization that the church lot has really successfully opened up a lot of spots on campus. So we're timing this all very carefully so that the new parking lot hits before we would need to take any spots on the existing campus away temporarily during the build.
Bill Stubblefield.
Yeah, good morning, Jeannie. You have not mentioned single bed rooms. Are you still progressing toward 100% single beds?
So when the new tower is complete, it will be entirely private rooms, 325 licensed beds, all private rooms. So we are moving that way. We know that that is the preference of our community and really the way that medicine has evolved. So that will be a really big upgrade for folks when we have all private rooms.
That'll be when again, please?
So everything is expected to be complete by 2028.
2028, okay. You mentioned providers. I think you said 130 new jobs. A few years ago, there was a lot of difficulty competing with other hospitals, other regions for the specialists you're looking for. Have you been able to overcome that? Are you getting the doctors or the providers you need?
Yeah, you know what? It is. Healthcare is really competitive, right? But what I have found and observed is we are attracting really top-notch physicians and providers to our region. There's a couple of reasons why I think we're successfully getting them here. I think one is our affiliation with WVU and the academic track. So a lot of our physicians and providers are faculty, and they love the opportunity to have residents and medical students and the academic affiliation. That's important to a lot of physicians. So that's a really big attraction point. As we continue to grow and invest in our region and in our infrastructure, we're finding that's also attractive to physicians and providers. So, example, we're on our way to open heart surgery. Our goal is to open that program in October. So as we recruit for those types of cardiologists, it does attract other specialists in as well. So as the level of care goes higher and higher, it kind of elevates who wants to come work in your health system. So we have had continued success with our physician recruitment. I think healthcare generally, it's challenging to find the workers. We know that there are some shortages, specifically in areas like nurses, some of the tech positions. So we're being really proactive in those spaces as well. So we know as each of these building projects come to completion, there's going to be need for additional staff. So when you add a significant amount of hospital beds, you need to prepare for the additional staff, not just physicians, but nurses and techs and other, even just support services like security officers, right? You have to scale everything up. So we're working deep with our partnerships with a lot of the technical schools, with the local nursing programs, with our own WVU university programs to make sure we have really aggressive and proactive plans so that when we do open these services that are needed in the community, they're adequately staffed. So, yeah, lots of staffing going on. Our HR partners are really, really busy people.
So, Jeannie, in terms of nursing, what percentage of your team, how many travel nurses do you have now? Are you still relying on that as heavily? Obviously not as heavily as you did during COVID, but do you have a sense of how many travel nurses you've got?
Yeah, we are really working to reduce the number of travelers. I wouldn't say that we're relying on them at this point. We've done a really good job of building permanent staff. We do have a couple programs within our organization that are fantastic, where we have WVU travelers. So they work for the WVU medicine system, and we assign them based on areas that need them. So that's been a really great advantage because they're permanent staff. We're investing in them, and they can kind of ebb and flow with the different censuses. We do have a few travel contracts still out there. I know our goal is to eventually have 0 travel contracts. Right now, at both of our hospitals, at Berkeley Medical Center and Jefferson, we do have really high census. And there's a lot of reasons for that. We're headed into that respiratory illness season. And so there are times where you need to bring them in just to offer safe care. But our numbers are much lower than they've been with travel nurses, and we have more staff than we've ever had. So that trend has certainly reversed. And we're excited about it because it's always better for the patient when you can have long-term, employees who are part of the community and are committed to the organization, and they're very familiar with the hospital. And so I think we're starting to see like a major light at the end of the tunnel that we noticed during COVID, where you really needed to bring a high number of travelers in. We've really been able to reduce that.
Jeannie, let's go to the other part of the equation, that is funding and support. There's a lot of uncertainty now about the future of healthcare funding. What level of difficulty is that imposing upon you and the hospital and WVU for addressing the possibility of this wide-ranging impact of funding?
Yeah, so I mean, there's always questions and there's always things you have to think about and consider as you're planning. We have had a really good year financially at WVU Medicine in the East region. There's a lot of reasons for that. One of them is that we have never had higher volumes at all of our clinics. We've brought in services that traditionally some of our neighbors had to leave the area for, or they went to competitors for. So we've been able to really change our market share, and that dynamic has really done well for us, so we can reinvest in a lot of these programs and building projects. So I would say we're ending this year on a really high note financially. I think that there's always things you have to be planning for and thinking about. And I'll say our finance team is fantastic. I've observed that they're, always looking, down the road and considering how impactful projects like DPP are going to work. But I can tell you that we've exceeded our operating margin goals for 12 straight months. And that does enable us to invest in people, facilities, and technology. So, you never know what's going to happen next year, but you have to do the best you can with what you have right now. We are always fundraising, and we are always looking for ways to engage the community in our mission with us. And so there's things going on that we're preparing to launch our capital campaign. We are doing our year-end appeal in hopes of getting a little bit of support for some of the infusion chairs that will be placed at the Jefferson Cancer Center when that opens up. So there's always kind of this balance between getting volume in the door, raising money, and thinking about policies and their impact. But at the moment, I think we're feeling really confident in where we're at.
Jeannie Constable, our guest here on the program from WVU Medicine. Jeannie, has the H-1B visa increase in fees, a substantial increase, affected your ability to attract additional physicians?
Oh, that's a really good question. I don't know that it's had an impact. I could check into it and let you know, but I haven't heard of an impact. But to be fair, I'm not in the human resources department doing that paperwork, so I don't know. I'd have to check with them.
I appreciate that. If you have any additional information on that in the future, please share it. I've heard other hospitals complain about that, and some other places that recruit regarding those visas, and I guess the price of those have gone up substantially, I think to $100,000 or something to that effect. Go ahead, Bill.
Yeah, Jeannie, you mentioned earlier $60 million for your capital that you're building, but yet the projects that you laid out, in my mind, would far exceed the $60 million. Did I misunderstand the $60 million, or do you have another source of revenue?
So the $60 million is the investment just in the Jefferson building. Altogether, when you look at the Berkeley project and the Jefferson, we are over $200 million being invested. This was announced about a year ago. The investment, I believe there's a press release. It was actually before I joined the organization, but there was a $200.9 million investment announced in early 2025 by the WVU medicine system into this region. So that $260 million was provided by our WVU medicine system to help support and fund these two major projects as well as several other ones. And so that's an incredible investment in the future of our community. So again, the $200.9 million is for the Berkeley campus infrastructure. The $60 million is for the Jefferson campus infrastructure.
Yeah, Berkeley and Jefferson County have been treated very well by WVU medicine.
You know, it's funny because I was just looking at some timelines, and I realized that Berkeley and Jefferson, joined WVU medicine 20 years ago, in the year 2005. So we've had 20 years of benefit from this affiliation. And I think you hit the nail right on the head. I think this has been an incredible thing for our community, because not only does it bring in that kind of investment by the system, but think about all of the academic affiliation and impact. We have about 500 medical students and residents rotating through our clinic. So if you think about the education value to the region, the recruitment value of being affiliated with an academic medical institution, I don't know that you could put a number on the value, but I certainly know that it saved lives and it's made healthcare accessible in this community, and it's an incredible partnership.
Jeannie, we are just about out of time, about a minute left. You don't need all of it. I mean, you don't have to use all of it if you don't need it, but your final word is yours.
You know, I would just encourage everyone to follow us on Facebook. We have some really great stories. We had a special delivery, we call it, little baby born in the parking lot at Berkeley. She was a little eager. She didn't want to wait till mom could get inside the hospital. So
Yikes.
We have some really great stories and content our team is putting together. And I think if you're interested in learning more and staying up to date on all the great things we're doing, following us on Facebook is a fantastic start.
Great to speak with you. Thank you so much, Jeannie.
Thank you, Jeannie.
You as well. Have a great day.